Okay, so welcome to the next module on neurologic disorders. There's an assortment of topics we're going to discuss in this module. We're going to start with strokes and the different types of strokes that patients can develop, followed by the concept of a TIA, a transient ischemic attack. Then we're going to go briefly into epilepsy, and then talk about some common headaches that patients get. Then we'll discuss a few neurodegenerative diseases, so diseases that are caused typically by aging, followed by increased intracerebral pressures, so increased pressure within the brain we'll talk about. And part of that talk will be traumatic brain injuries. Okay. And then we'll just talk about neural tube defects, followed by spinal cord injuries. We're going to talk a bit about different types of pain. And lastly, we're going to talk about some examples of peripheral neuropathies. Okay, so there's lots to talk about in this module. I hope you find it interesting. Okay, so let's do a little review of the central and peripheral nervous system. So remember, the central nervous system is made up of the brain and the spinal cord. And the brain wants to obtain information, and that's through its afferent division, meaning signals that are coming to the brain. And they can be in two forms. They can be sensory stimuli, such as from the skin, soft tissue, and they can be visceral stimuli, meaning from the internal organs. Okay, so either one of those can provide information to the central nervous system. Okay, what about the efferent division? So outgoing signals from the brain and the spinal cord. So the brain can send signals from obviously the central nervous system to the peripheral nervous system, and it can then be split up into two divisions. You have your somatic nervous system, which is your motor neurons to your skeletal muscles, right? So the neuromuscular system, okay, in order for you to move your voluntary skeletal muscles. Okay, and then we have the autonomic nervous system, which is typically not under your control. It's an involuntary system for many parts of the body that you don't need to be involved in on a minute-to-minute basis, which is what's happening in the autonomic nervous system. Constant adjustments of different organs in order to maintain homeostasis, okay? And the autonomic nervous system is split into the sympathetic division and the parasympathetic division. And they typically innervate smooth muscles, such as in your eye, or your gastrointestinal tract, or your blood vessels. They innervate the heart. They often control secretions from exocrine glands, such as the pancreas. And they are also involved in overall homeostasis of a number of other organs. Okay, so if you're thinking of the autonomic nervous system, think of the eyes, think of the lacrimal glands in the to produce secretions, to moisturize the eye. Think of the salivary glands. Think of the entire gastrointestinal tract that is reliant on the autonomic nervous system to increase secretions or increase peristalsis for digestion. So that would be more of the parasympathetic system. Think of the urinary system in order to control bladder contractions, and allow urination. Think of the heart. Think of the lungs. Think of what it does to the liver and also to the kidney. For example, the sympathetic nervous system can stimulate the kidney to release renin. The sympathetic system can stimulate the liver to break down glycogen to glucose. Okay, so that's an important division. I know that you've covered it. Hopefully, this brings back a bit of that memory. Okay, so you have your efferent division bringing signals into the brain, and you have an efferent division that's taking signals from the brain to different parts of the body. Okay, so let's just have a look at this image briefly, so that when we're talking about strokes later, when we're talking about nervous system conditions, there's an image that you can bring up. So what's contained within the cranium, the cranial vault, okay, or what's contained within your skull? So that's going to be 3 parts. So the cerebrum, which is made up of 4 lobes, the frontal, parietal, occipital, and temporal lobes. Your cerebellum, which is at the back of your cranial vault, okay, and the brainstem, which is made up of the midbrain, the pons, and the medulla, and that goes on to form the spinal cord. Okay. The peripheral system, the peripheral nervous system, remember, is made up of the autonomic nervous system, which has sympathetic and parasympathetic components, and the somatic system, which has motor components, say to move muscles, and sensory components to bring input and signals back to the spinal cord and be relayed to the brain. Okay, so let's just briefly discuss a couple of functions of the different lobes of the brain. Okay, so when we look at the frontal lobe, well, that's going to have the motor cortex. That's going to be responsible for movement of different parts of your body, right? And the fibers on the left side of your brain will cross over in the medulla, in the brainstem, to the right side. So your left cortex controls the right side of your body in terms of motor and sensory. Okay, just like the right side of your body, or the right side hemisphere controls the left side of your body for motor control and for sensory input. Okay, so the frontal lobe has motor control at the motor cortex. The frontal lobe's also involved in problem solving and also speech production at an area called Broca's area. Okay, so it produces speech. So it formulates the words and produces speech. Okay. What about the temporal lobe? So the temporal lobe is going to be involved in auditory processing. So processing of what you're hearing. It's going to also be involved in smell. Okay, the processing of smell. It has the ability to retrieve memory and information. And lastly, but really important, understanding language. So comprehending what someone is saying to you. And that's in a part of the temporal lobe called Wernicke's area. Okay, so Wernicke's area in the temporal lobe, you can interpret what someone is saying to you, and Broca's area in the frontal lobe, you can speak back to them. Okay. The parietal lobe, well, that's where there's going to be right at the front of the parietal lobe, there's the sensory cortex. So that's going to be responsible for sensation, of touch, of heat, of pain. It will be sensed there. Okay. The parietal lobe is also involved in body orientation. Okay. There's also an area for interpretation of reading and interpretation of taste. Okay. The occipital lobe, well, that's mainly going to be involved in vision. Okay. So the optic nerves from the eye through tracts in the brain make their way to the occipital lobe. The cerebellum, very involved in balance and coordination and motor movement. Okay. And lastly, in a general sense, the brainstem is mainly involved in involuntary controls. So respiratory rate, blood pressure, heart rate. So a lot of parts that are under involuntary control. Okay. And a lot of the cranial nerves are leaving parts of the brainstem, in particular the pons. So there's 12 cranial nerves. Some of them are motor, some of them are sensory nerves, and they're coming in at the brainstem level. Okay, so let's look in a general sense the corticospinal tract, which is the motor tract from the brain. And remember, that comes from the frontal cortex, right? And then the sensory part of the brain, and that will come from the periphery back up to the brain with the spinal thalamic tract. Okay, so let's follow the corticospinal tract. So that's in blue here. So it's going to start at the motor cortex, and the fibers are going to descend through the brain to the medulla, and there's going to be a crossover of fibers for the most part. About 80 to 90% of the motor fibers cross over to the other side of the nervous system. Okay, and we call that site the brainstem decussation. Okay, brainstem decussation, and that's where the nerves of the corticospinal tract cross over, and that's going to control the motor movements of the other side of the body. Okay, and we can do the same for the other hemisphere. Okay, now what about sensation coming from the periphery? Well, that typically crosses over at the spinal cord level. Okay, so for example, the sensation of your left leg. So the peripheral nerve, the sensory nerve fibers are going to travel to the spinal cord. And shortly after entering, they're going to cross over to the other side. And in the spinal thalamic tract, they're going to go up to the sensory cortex, which is in the parietal lobe. Okay, so if you look at that first slide, you'll see that sensation is in the parietal lobe, so in the sensory cortex, and movement or the motor cortex is in the frontal lobe. Okay, let's just talk a bit about the anatomy of the blood supply to the brain. Okay, so there's going to be two main arteries on each side of your neck that are going to go through the skull and into the brain. So on each side of your neck, you're going to have an internal carotid and a vertebral artery. So if you look at the image on the right, you'll see that that there's the internal carotid that's branching off the common carotid. Okay, that's going to go through the cranium, so the cranial vault, and supply blood to the brain, and so is the vertebral artery. Okay. Okay, so let's look at the image on the left. So the vertebral artery on each side, which is following the front of the spinal cord, and is on the front of the brainstem, is going to go up, and now the internal carotid arteries are cut off here. They'd kind of be coming towards you. We're looking at the bottom side of the brain here. Okay, so the internal carotid arteries are the two large arteries that looks like they've been cut off there. So one on each side. Okay, so basically the two vertebral arteries become a basilar artery, and that goes up and meets the two internal carotid arteries, and they form what's called a circle of Willis. Okay, and from the circle of Willis is where you're going to get blood going anteriorly. So in this image, it would be the top blood vessels going up. They'd be called the anterior cerebral artery. The artery on each side going left and right would be called the middle cerebral artery. And at the bottom of the circle of Willis, near the basilar artery, is the posterior cerebral artery. So anterior, middle, and posterior cerebral arteries to feed different parts of the brain. Okay. One more thing to mention about the circle of Willis. This is typically where we find berry aneurysms. Okay. So berry aneurysms will come up when we're talking about hemorrhages of the brain, because they're a weakening of the artery, and sometimes, unfortunately, they can rupture. Okay, so I think just to get a bit of a feel for the blood supply of the brain will help you understand when we're talking about strokes, and depending on where the stroke is, will determine the symptoms that the patient has. Okay. So, and where the stroke occurs depends where either the hemorrhage or the arterial occlusion occurs, and we'll talk more about that in some upcoming slides. Okay. Okay, so this image is really just showing you the two different branches, right? So there's the afferent division, or the afferent nerve, that's bringing sensory information into the spinal cord that will then be relayed up to the brain. And then there's the efferent division, which is the division, it's the motor division, right? So the efferent division is going to go from the spinal cord to different either organs or to muscles to cause an action at the target site.